when we talk about medicine under siege, or even how to manage people's life under siege, we should consider the psychological issues. The psychological issues actually have been underestimated by many of people worldwide, actually, and we do not give adequate care for what conflicts or even natural disasters can do with human being psychological status, and how it influences human being during the event or during the conflict or the natural disaster, or and how it impacts their lives even after, and how it can impact the lives of the generations. Dr. Ahmed Abdalla will give us the talk now about uh, the siege management, stress disorders versus growth opportunities. Dr. Ahmed Abdalla, Professor Ahmed Abdalla, you are welcome. You can share your PowerPoint presentation, and we are all listening.
Okay.
Thank you.
Let me start by saying that when I try to talk about what's going on from a psychiatric or a psychological point of view, I found that the mainstream, the majority actually of scholars are talking about what's so-called post-traumatic stress disorder, which is one page only on if we are talking about a book dealing with a disaster or a war or a siege like this. Um, all colleagues are just waiting for the conflict to end. Then they supposed to start their work in trauma treatment, trauma management, according to the paradigm of post-traumatic stress disorder. Let us put some light on such a page of post-traumatic stress disorder, and then see what do we have more. So this is an example of showing the issue, race-based trauma. What we are witnessing could called race-based trauma. Race-based trauma or racial trauma refers to the effects of racism and or racial violence on an individual mental and physical health. سامعني? Do you hear me?
Yes, sir.
Okay.
تمام.
The impacts of watching your community be brutalized, killed by the police, or murdered in a genocide has so many effects mentally, emotionally, and physically. There is two types of racial trauma or psychological trauma in general. The direct type, if we are the ones who experience the violence directly, and indirect trauma if we are witnessing other in our community experience the violence. Here, if we are from the same people, from the same race, from the same Palestinians are our sons, sisters, daughters, people from the same color, from the same nation, experience a systemic racism every day, and they in the issue of trauma we have these two types. Here it gives the example of Black Americans or indigenous people across the globe, in Australia, in America itself. Right now, Palestinians and those who identify with them. So if you are a Palestinian, lives in Gaza, or you are a Palestinian outside, or anybody who see yourself, if you see yourself one of them, if you are identifying yourself with them, all over the world, we are impacted by race-based trauma. Those in Palestine are being constantly bombarded and attacked. Those in the diaspora are live streaming genocide, seeing this, living this, and feeling the effects, on top of witnessing violence against other Palestinians in the diaspora, as here the photo of this young kid who was stabbed, and these three young men were being shotted in a mall in United States. So we are all, if we are identifying ourselves with Palestinians, we are all under attack. We are all living some sort of trauma. Okay, so what are the signs and symptoms? Some signs and symptoms are mentioned here. Being super aware. Sometimes it is called hyper aroused. If you feel hyper aroused, super aware of your surroundings, super suspicious about people and things, feeling guilt or self-blame. Now we are seeing vast majority of Arabs and Muslims, they are feeling guilty. They blame themselves that they are not efficient, they are not supporting or supportive on the level of the massacre, or on the level of what's going on. Having trouble in concentration and in remembering things. This is one of the symptoms of being in trauma, that you are in troubled concentration, you are, or you have very tough difficulties in remembering things. Being on edge, very irritable or aggressive most of the time, having trouble sleeping or having nightmares about the violence. Many of us having trouble sleeping for more than 2 months now. And when we sleep, we could have nightmares about the violence. Being afraid of worried about similar events happening again. So this fear that what is happening in Gaza could happen here, could happen where you are, or could happen tomorrow or after a while where you are. So this expectation all the time, bad expectations, being afraid or worried about similar events happening again, mistrusting authority figures and others. Sometimes you find that politicians, figures in international organizations are telling lies, so you mistrust them, and this make the problem worse, even worse actually. Having difficulty planning or thinking about the future, not only about the contemporary or about this moment, but the future as well. You have very difficult planning or thinking about future. The effects of trauma are not only mental or psychological, but it affects physical health. Trauma is stored in our bodies, slowly enacting the damage as it is processed little by little. The very famous book called um, the body keeps the trauma. Trauma increases inflammation, which contribute to many diseases like cardiovascular disease and autoimmune disorders. If we experience this trauma over and over again, or live in a constant stress uh, situation, we are even more likely to have these health issues. Is it for our generation? No, it is transgenerational. Trauma is transgenerational. Once I met a colleague from Spain. He wrote a book about the civil war in Spain, something like around 1 century ago, or less than 1 century, something like 80 to 20 years ago. And the effect of this war, trauma, on the generation, a generation after a generation. Research has shown that the effects of trauma get passed down across 3 generations at least. This is called transgenerational or intergenerational trauma. This means that if I am a grandparent or my grandparent experienced trauma, like during the Nakba in 1948, the physical effects, the mental effects of that get passed down to my parents and then to me, and from me to my siblings. The 3 generation clock starts over with each generation that experiences trauma. Mainstream psychology, the idea that people can experience trauma from witnessing racial violence against their community, does not exist in DSM. DSM, that is the manual, the American manual that defines mental disorders. In DSM says witnessing violence through media doesn't count as trauma unless you are witnessing it through your job, as if you are a journalist or working in ambulance, or it is happening to a close family member or friend, which reinforce on capitalist individualism. This individualist by book folk and may interfere with the accessing services. Actually, this is a very specialized debate. If you are, or the second trauma, it is a real trauma or it is not a complete trauma. And this is not important or not that important, cause by successive witnessing, by successive seeing videos and reports on media, by TV channels. Actually, it is or putting you in the place of having trauma without being in the place of the bombarding or the violence. What could we do? The first step is recognizing how we are being affected by the violence and oppression around us. By identifying what is happening within us, we can find empowerment rather than paralysis, build community, and combat gaslighting that seeks to invalidate us. Actually, from here, they start to give something like option. You can just get the effects of trauma and be paralyzed with having these effects, and you can, this is an option, or you can deal, you can perceive, you can respond in other modalities. I will talk about this in details later. So you may be able to find a therapist that recognizes race-based trauma and takes social justice approach to therapy, but they are hard to come by and there are limits to individual therapy. So here, if we are talking about healing, about therapy, it is limited by your opportunity to access treatment. Do you have sufficient therapists? Do we have clinics? Do we have online sessions? So this is one of the problems, actually, the classical problems, that insufficient resources to deal with such a big trauma. So because of this shortage, we always shift to community healing. Community healing can be the most powerful in these times, connecting with others like us and with people in other communities who have experienced similar forms of oppression can both help us to emotionally process the trauma as well as to work together to think about liberation. We need to address the roots of race-based trauma once and for all to build a different world and achieve liberation. We must be in community. So this an alternative, one of alternative or alternatives for trauma treatment under such a sea, that we base our intervention on community healing. So we are trying to use community as a unit of therapy, as a unit of group therapy. Many actually therapies are dealing with group therapies, community and group therapies, like psychodrama, like sociodrama, like theater of oppressed modalities that try to use groups, to use community as a unit of healing. So when we pass a trauma, we have three options, as I said. Just to get impairment or dysfunction, this is the road of post-traumatic stress disorder. The second option is to come back to the situation we had by the trauma, we had before the trauma. The other or the third option is to get a better life as a result of learning from its lesson. That's to say, being stronger mentally, socially, and spiritually. And by this, we mean growth. So all of these are just possibilities, and we take one or other possibility. We take the stress disorder possibility or growth possibility by choosing our response, by managing our response to the events that we are seeing. Change or shift in understanding ourselves, our surrounding world, and our strong points for future. We could take this option by managing our response or our responses to what's going on. when they talk about growth, they talk about 5 points. And these points is not only an outcome. We could see that we are, or we could working on these 5 points during the SIG. And this is my point, my intervention point actually is this, for colleagues in the same specialty and for others, that we could work on such 5 points from now. The first point is dealing with relationships. We could reshape relationships. We could know who is with us, who is against. Now, some people in United States could be with us or with Palestine more than some other neighbors or some other people from Egypt. So building a new positive relations, building a victory nation is possible. Number 2, knowing our internal strengths and weaknesses. During the siege and after, we experience, we examine our strength points and our weak points. We discover ourselves. Actually, this trauma gives us the opportunity to rediscover and discover ourselves. The third point is setting new goals and horizons, opportunities for future, depending on new positive relations and depending on seeing and knowing our strengths and weaknesses, we could build new goals, new horizons for future. Number 4, to value life, to value my life, to rethink my life, remaining time on earth, to rethink my remaining time on earth. What is the best plan for this remaining time? Better time.
Dr. Ahmed, please just, it's 5 minutes for the next talk.
Okay.
So, okay, thank you.
Okay. Number 5, discovering or tackling new spirituality, rediscover our religion in depth. Now people all over the world are examining or discovering and rediscovering Islam and Quran and such things. This is one of the gain. We could gain this as well. And they actually, to end by this, they set a relation between what's so-called psychological hardness and growth. And they mention 3 aspects of hardness, psychological hardness: commitment, control, challenge. 3 C's: commitment, control, challenge. And we could work on these three C's from now. Commitment, how to appreciate, emphasize our and their commitment, our sisters and brothers in Gaza, their commitment towards their family, their homeland. How to appreciate their emotional control. This is control. How to appreciate their emotional control and emotional, amazing, actually, emotional control, amazing emotional management. And challenge, how we deal with what's going on as a challenge more than a threat, a challenge for our imagination, of our trying to deal with the hardness around us, it is a challenge more than a threat. I could stop here, and if there is extra time or discussion, I could add some few points.
Thank you very much, Dr. Ahmed, for this informative. And as I have said before, it's very important, the psychological support and the psychological management for people under siege or living conflict issues as what's going on in Gaza these days. So thank you very much.